Hi, this is Dr. Megan from Balance Within PT. So today I want to talk about a pelvic floor assessment and evaluation, what that looks like and what all is involved, and hopefully take out some of the mystery of it. So maybe you've been told by a doctor or a PT that you need to see a pelvic floor PT. Or maybe you've been reading things online, maybe you're dealing with some urinary incontinence or pelvic pain and you're thinking, maybe this could be useful, but I don't know, it sounds kind of weird and I'm not really sure what it's about. So this video is for you then. So when I see someone for a pelvic floor assessment, first I'm gonna take a really long time just getting to know you and your story and what brings you in here. So I'll ask a lot of questions and just have you tell me your whole background of everything regarding your symptoms and even from beforehand too. So I'll ask about some personal things, so about pregnancy, peeing, pooping, and sex. So all those are really related to pelvic floor issues. And even if your kids are 40 years old, that pregnancy can still be a factor with your symptoms now too. So I'll take a really good long time getting to know that whole background so we can get to that root issue. Then we'll do more of a kind of typical assessment where I'm going to look at things like your posture, your strength, your flexibility, your alignment and your pelvis and your spine, and do some different tests like that, kind of more of a traditional PT route. But then we'll determine if it seems like a pelvic floor assessment would be beneficial for you. So that's what I kind of want to explain right now, what that looks like, what's the reasoning before it, and what you would expect for that. So if we determine a pelvic floor assessment is a route that would be beneficial for you and you feel 100% on board with that, then we would proceed forward with that. I don't usually do it the first visit. It's usually after a visit or two with it, depending on your specific goals and needs. But I want to show you with this model here. So we have a pelvic floor model here. So all of this red stuff in here, that's all your pelvic floor muscles. So they're on the inside. We can't really see them externally too well. So the best way, the gold standard for assessing pelvic floor strength is through an internal vaginal assessment. So I always tell people it's not like you would get at an OBGYN where there's stirrups and the speculum involved. It's much less invasive than that. But what it would look like is I would want to check things externally first. So the first layer of your pelvic floor you can see externally and to some degree. So I'd want to feel around those tissues to see if they're tight, if they're red or irritated or painful. I'd also want to have you try to do a Kegel or a pelvic floor lift and see if you're able to do that, and see if that feels like you're able to relax it as well too. Then we want to do the internal assessment. So let's take one gloved finger. The pelvic floor is 3 layers, and each layer is about a knuckle deep. So you have first layer, second layer, and third layer. So I'd be assessing one layer by layer. So I'd feel, again, this through vaginal assessment. So I'd be feeling around that vaginal opening for that first layer of your pelvic floor to see, again, is it tight? Is it painful? It should not be painful at all. So if there is any pain, we want to figure out why. And then go on to the second and then that third layer. Third layer is the big layer. That's where all these deeper, that pelvic bowl is. So I'd be kind of sweeping around to feel for trigger points, tightness, irritation. And then I want to see, do you know how to do a pelvic floor contraction? So do you know how to squeeze? Do you know how to relax? And then what's your strength and endurance like for that too? So this part can be really empowering for people because a lot of people have no idea if they're doing their pelvic floor exercises or correctly, or if they know how to do that. So you're going to walk away from that session knowing, yeah, I got it, I'm doing it right. Or maybe I wasn't doing it right, but now I know how to do it. Or maybe you don't need pelvic floor strengthening at all. Maybe you have tightness, and so you can learn some strategies right there in that session about how to relax your pelvic floor and to start helping you heal with issues like incontinence or pelvic pain, prolapse, all sorts of different things too. So the whole assessment takes about a couple minutes. It's pretty quick. Again, should not be painful. If it is, we want to figure out why and get to that root issue. But it can be a really great tool for us to know how to really truly help you get better and to get you that control that you want to get rid of those symptoms, so you're not having to deal with things like leaking when you're sneezing or trying to pick up your kids or having any pelvic pain issues, as well too. So hopefully that cleared up some of the mystery behind it. Please give us a call if you have any questions, want to learn more, or visit our website at www.balancewithinpt.com. Thank you.